leading cause of death in the United States, and that's why it's so important to get the proper screening and make sure that you have your levels where they need to be. We're going to send it out now to Pam Giganti, who is outside of the Broward Health Bus getting ready to take some health tests herself.
Thanks, Sherry, and all of us gals were in our red today because it is Go Red for Women Day, which was promoted by the American Heart Association to get women to really understand what the risks are for heart disease, because a lot of women don't know what those risks are. A lot of people think that heart attacks really just happen in men, but that's not necessarily the case. I'm outside right now with Broward Health cardiologist Dr. Rick Howard. Great to see you.
Good morning.
We're in front of this great bus here, the Broward Health Heart Bus.
It's hard to say,
right?
isn't it?
And this is such a great tool because you go around town with this bus and you screen people and really give them an opportunity to see if they are at risk. What are you looking for?
Well, I think it is a good opportunity to go into the general population. These are patients that may not ever have seen a doctor or maybe see a doctor once in a while. We're looking at things that really over time lead to heart disease, blocked arteries in the heart, damaging the heart muscle. So we check things like blood pressure, if you have high blood pressure or not, cholesterol, the fat that clogs up your arteries. And they also have a little bit testing that can look at your arteries, your carotid arteries, if your arteries are getting stiff, and even echocardiograms and EKGs. So it's really a great screening tool.
And there are a lot of women who think, like I'm in my 40s, for example, and I might think, oh, I'm still really young, I feel young, I don't have to worry about heart disease. But you say that's not necessarily the case, right?
Well, you are still very young, so we won't change that. But I think earlier and earlier people are developing blocked arteries, and it's a process that we're developing as a society. We're not exercising well, we're not eating well.
Right.
So every month I see 1 or 2 women in their 30s or 40s with heart attacks, and men as well.
All right, doctor, now that we're inside the bus, tell me what tests we're actually going to be doing today.
Okay. Well, through the magic of television, you've already registered.
That's right. You have all my information.
All the information is here. So there are a variety of tests that you can have done. Of course, blood pressure, cholesterol. We're going to do carotid studies to look at your carotid arteries. You can have an abdominal ultrasound to see about your abdominal aorta, if it's dilated or not.
Okay.
And an EKG as well.
All right, great. So we're going to get started. So, doctor, what test is this?
Well, this is a carotid ultrasound, and this is one of the tests we look to see if there's any evidence of atherosclerosis or plaque buildup in any of your arteries. It also shows us if your arteries are stiffening or not, and if you've had any evidence of atherosclerosis or hardening of the arteries.
Now, do you necessarily have to have heart disease in your family, or no, you could be the first one to have an issue?
You could be the first one, and it's all about risk factors. That's why it's important to discuss those with your doctor. And they're cumulative. They add up. Family history is one, but high blood pressure is another, and of course that's what we're screening for. High cholesterol, smoking, of course, is really dangerous and should not be done. Exercise, whether or not you're obese, all of these things help over time to clog up the arteries.
Okay, so what happens after all of my results? Let's say that there were some risk factors involved, that there were some things that were found to be high. Those results go to a cardiologist such as yourself, correct?
Sure. This takes about 20 or 30 minutes here. We're just showing a small portion of it. Then you get the results, and then you will be following up with a physician to discuss what the results mean for you.
All right, so we're all screened and everything looks good. So that was good news for me personally, doctor. Thank you.
Of course.
So for the folks who are watching and who are interested in getting screened, all they need to do is go to, you have a great website, browardheartbeat.com. What are they going to find on the website? They're
going to find the locations of the screenings. We have them all over Broward County when they can go, and more specific information about things like that.
All right, great. So check it out and make sure this is a great time. February is the time to get heart healthy. Back